Hello and welcome to our Care and Practice series. This panel discussion today will focus on housing care participants and hearing from different county representatives who are implementing care on the ground and their approach to housing. Before we get started, I wanted to share a few resources. We have the CARE Act Resource Center. There are many resources for you if you want to better understand care or look at different topics. On our training and resource library, you can filter by different topics and audiences to find questions that you're looking for. We also post upcoming trainings. We have a county directory that leads you to the county behavioral health website specific to care and relevant court websites relevant to care. And we also have FAQs. There are a number of ways to get a hold of us, but there really is no wrong door. So you see that email address if you have a question. If you need technical assistance, you could go ahead and email that email address and we will look to get you what you need. So a preview of this discussion, we'll have a recording of a live event that was held with some panelists, and we had some housing resource roundup, and then there was a panel discussion that bled into an open Q&A discussion. There was some healthy discussion by the panelists. So Anthony, in a moment, will introduce the panelists for today, but facilitating this discussion are Anthony Federico and Debbie Witham with HMA. So Anthony Federico is a senior consultant in HMA, and he has a lot of experience in housing and homelessness, specializing in program design and health system partnerships. Debbie Witham is a principal with our HMA team, and she has extensive experience in housing and social services with a focus on behavioral health and substance use disorders. So we're pleased to be joined by them today, and they'll go ahead and introduce their panelists during that portion. So we're now going to turn to that live discussion and start off with Anthony Federico.
Sounds good. Thanks, Patricia. And good morning, everyone. Really been looking forward to today's panel. And like Patricia said, my job and Debbie's job, we're going to say a few words and then get out of the way to get some panelist conversation going so we can hear more about all of your experience with housing and the CARE Act. But first, a few words about housing resources. So housing has already been a focus of all of our CARE Act work since day one, right? And that's why HMA and county partners and DHCS have already put together a number of really good housing-focused trainings and resources. And that's what's summarized on the left-hand part of this slide. And all of those resources are housed on the CARE Act Resource Center at care-act.org. But on the right, we have a flyer that spells out some specific types of housing TA projects that HMA is available to support you with. Just a few quick examples. We're available to help facilitate planning between county behavioral health and your partner county housing agencies so that you can get more integrated on providing housing solutions for this population. We can also do even smaller, more limited and technical projects, like we can create an inventory of your county housing programs if all of that info doesn't already live in your one place, so that you all can have a better sense and a more centralized way of looking at county housing opportunities that might be a good fit for CARE Act respondents who you're trying to support on the path to housing. And then finally, we're here to help identify housing resources and strategize with you for how to sustain and expand housing opportunities in the community. And that could be through CalAIM funding and Behavioral Health Services Act funding and opportunities. We're here for that work too. But if you have some other need or some other project, and I didn't just say it, and it's not here on the flyer, that's also fine. That's also fine. Please still get in touch. The point of kind of these remarks and that flyer there on the screen was just to suggest some ways for how HMA could plug in and support some of your work. And it really starts with you all and your needs, and however we can support you, we'd love to jump in and help. Yes, so in recent months and recent weeks, we've done many one-on-one meetings with county care act reps and leads like yourselves. And the number one question we're getting is about funding, right? What is the funding landscape? And in particular, what state grants are available for counties to take advantage of as we're trying to address housing scarcity, improve and expand our portfolio of housing programs and opportunities for this population. And DHCS has compiled a lot of information about those funding opportunities and related initiatives and put them on a new webpage, which is called Housing for Health, and it's linked to right there at the bottom left-hand corner of the slide. So please have a look there. On the right, we wanted to pull out and highlight for you some of the programs, a subset of the programs that are especially well aligned to care. You and your local county behavioral health systems of care are probably already aware of these and maybe working on applications and have probably received awards in prior rounds. The one I will say a word about is HomeKey Plus right here at the top. And the reason I want to single that out is because that is open right now. So this is a funding opportunity you can take advantage of now. This program is designed not specifically for character respondents, but for that sort of broader population of which care respondents are a subset. So this gets us to the focus of today's conversation. We're getting to the panel discussion. I would love to introduce all of our panelists from Merced County. Merced is represented by Delilah Garza, who serves as the Community Enrichment Director for County Behavioral Health and Recovery Services, as well as Alexandra Pierce, the Assistant Director of County BHRS. Tuolumne is here, represented by Evan Hammond, who serves as the Supportive Housing Agency Manager at Tuolumne County Behavioral Health. Sacramento, thanks also to you for joining from Sacramento. Nicole Cable, the Health Program Manager for the county over court and justice involved programs, and also Monica Rocco Wyatt, the Health Program Manager uh, over homelessness initiatives, including Sacramento's Homeless Engagement and Response Team. And then finally, thank you, San Bernardino, also for being here. San Bernardino is represented by Dr. Alice Belford, Deputy Director for County Behavioral Health, and Alicia Harris, a Program Manager over care within County BH. All right, so let me get us kicked off. We have a number of questions and they fit into the sort of theme areas you see here on the slide. We want to talk about partnerships. We also want to talk about local problem solving and success stories that you have encountered already in your County Care Act work. And I want to start with the first question, and I want to pose it first, I think, to Evan and Tuolumne. So all counties have had something like 4 months now since go live, but Tuolumne being a cohort 1 county has had more time than that, right? So I'd love to hear from you about the housing issues that have come up in that time. You're welcome to share about issues you expected. We'd also love to hear about some housing related Care Act issues that have come up that you didn't expect.
Well, our interim housing program is very new. And one thing I did not expect was people who were chronically homeless given their own bedroom and their own bathroom and a nice tranquil setting and just walk away from it. That was very surprising, and we've had that happen a couple times. Whereas our permanent supportive housing programs, whenever we get a placement for that, they're just ecstatic and are just so happy to finally have a permanent spot that they stay for often years. So that was very surprising to me. Someone having a choice between sleeping outside and having their own space, and they choose the former. So yeah, that was something that really surprised me.
I hear you, Evan. Yeah, thanks for noting that. I've definitely had that experience when supporting clients on their path from street to housing. And I'm curious, if we can how have you addressed that, or how have you worked through that with CARE Act respondents?
We have one particular client, a care court client, who has been chronically homeless for more than 3 years. He is very untrusting. We have a very talented case manager who is able to gain trust from this population. And in the last several weeks, she has made tremendous progress with him. But one approach that we tried with this client was to set him up in a hotel for a week. And our first attempt at this, he walked away from it after 2 days. The door was wide open. All of his stuff was on the floor. He was sleeping on the floor. Then we tried again. And each subsequent attempt, he stayed longer. And now he's at one of our local hotels permanently as of right now. And he's been sheltered for a consecutive 6 weeks, whereas before we would lose him after a day or two. So that was definitely a success. And that's kind of been our approach to care court clients, especially those getting immediately out of prison. We'll set them up in a hotel and see how they do in an unstructured environment for a week, and then we'll place them in our interim housing. And that has worked perfectly so far.
Oh, it is. So I'm hearing the continued engagement, maybe even after returns to homelessness, that you continue to show up and make those offers and to support clients and to help get them on and keep them on that housing pathway. And I recall a mentor of mine, the phrase was that the path to housing can be nonlinear and can involve however we want to think of it, steps like that or paths like that. Let me ask San Bernardino partners a similar question. Would love to hear about housing work, housing challenges, housing issues that have come up already in your first few months of CARE Act work. And same framing, we'd love to hear about issues that you expected and maybe also some issues that you didn't expect.
I'll let Alicia speak more to the treatment side of it. For San Bernardino, we really were able to leverage a lot of our existing housing continuum. So anything from shelter to permanent housing to adult residential facilities to locked facilities. We really are able to leverage the availability of those things. Also utilizing the funding to be able to bring on new projects. One in particular we're calling an enhanced shelter, which allows for us to place people out of hospital, out of jail, off the street in the immediate without any barriers at all. We're just putting them into this enhanced shelter, which gives us a time frame to get documents ready and anything necessary, because we know when someone is ready, we have to take them right then and there. We don't want to have any impeding barriers that will keep them from doing that. And then on the treatment side, I'll let Alicia speak more to detail. We're fairly new. We just started December 1 of this past year. So in terms of specifics, Alicia could speak to that.
Yeah, thank you. I think sort of along the same lines as what Evan was saying, but a lot newer to the process is just the amount of, when you think about it, these are individuals who don't have a good history of treatment involvement and engagement in the system. So it makes sense in that way. So just the amount of time and, continued engagements and trying to build rapport just to get to the housing part. I'm not even talking about the treatment part. And so we have one individual right now. I think the original petition was in December, and we're just now getting to the point where he's willing to accept housing. But it took you know, continued conversations the whole past 3.5 months. His attorney very on board with the plan, and also his attorney, you know, going through a walkthrough with him, talking through with us. So just the amount of work to get, you know, someone to be on board with even having housing is, I think, was surprising to me. But as of today, he's on board, so we're happy about that.
Thanks, Alicia. Can I turn it over to Sacramento and Merced Partners? I'm curious to hear if any of this resonates with your experience supporting CARE Act respondents on the path to housing, and if you've also had this experience of needing to provide more support and a sort of higher touch support than with other individuals. Does this resonate?
Absolutely. I think I'll let Nicole speak more to the treatment piece, but I think they disproportionately qualify for full service partnerships, I believe. And for us, we've discovered that behavioral health bridge housing might not always be the most appropriate setting for them because of the lack of on-site support. However, we're actually looking at implementing behavioral health services on site at the behavioral health bridge housing. Even though we leverage our outpatient providers, we want a presence on site to help people stay stable.
Yeah, I'll definitely echo that. I think some of the challenges we expected were, the co-occurring with substance use, and we've definitely noticed that is a barrier, especially if we are able to get somebody into the low barrier housing, such as what Monica was describing in our BH housing. We have had issues with somebody getting exited because of substance use. I think the other thing that I was kind of cautious about as we started to engage the process was individuals that really do need a high level of support and supervision in order to be more successful in the community. And so that has made it a little challenging for us to fully utilize our bridge housing, because we don't know if it's going to be enough to keep them safe and to keep the community safe. We have in the past couple months in particular received some very high acuity clients, either coming back from state hospitals or coming out of local inpatient psychiatric hospitals that really may or may not be appropriate for community placements. And so we're kind of struggling with, how do you utilize what's available for bridge housing for somebody that really needs a much higher level of support. And so that's been one of the things that I've come across recently as we've gone through this.
Understood. And I want to put the question also to Merced, and I'll repeat it for Merced Partners, but I also want to invite county partners here on this panel to react to one another and to get into conversation among yourselves and among the panelists. Don't wait on me. Please just jump in and go ahead. If you want to follow up on something or do some solutioning or ask follow-up questions, please go ahead. So for Merced, would love to hear about housing issues that have come up in your CARE Act implementation experience so far, both the issues you expected and some of the ones maybe you didn't.
So one of the things that we dealt with is that our bridge housing went into effect almost a year before our CARE Act program went live. And so we've had really positive, good success within our bridging program. And so have not had a lot of openings available now with CARE Court starting. But also all of our bridging eggs were in one basket, so to speak. We had one specific site, and what we're finding with the implementation of CARE Court is that we really need to be able to diversify the types of placement based on, acuity and what the needs are of the individuals that are being served. And so really looking at utilizing a lot of kind of the network of our different programs and providers outside of bridge housing in order to support this population.
What we've also experienced in Merced County is our referrals have pretty much been a 50-50 split in terms of those being housed and unhoused. And what's been unexpected is that some of our housed clients have self-identified that their current housing environment may not be the most appropriate or helpful in terms of their needs. And so they've actually transitioned into some of our more supportive housing services through our community partners, and they've been quite successful in that environment. And so that is something that we did not expect for that transition to change from housed to somewhat of a step down. Although I will agree with my county partners in that the more support that they have in their environment, the more successful I've seen them prone to be. And so it has definitely been beneficial to those clients, even though it has essentially changed them from living independently with family to more of a not shelter per se, but more congregate living environment.
I feel like from Merced and Sacramento partners, I heard about a need to, as you put it, Alexandra, like diversify the housing available to you for CARE Act respondents, and that behavioral health bridge housing is a great resource, to a large extent was intended to dovetail with care and the care population, but that, you know, you are also receiving from different referral partners clients who may have a higher level of care need than what's served in those BHBH funded programs. So I think that brings us to the next question, where we want to ask about partnerships and your internal county partnerships and external community partnerships that you have built, because we know that you know, helping CARE Act respondents on the path to housing is probably too much work for just one provider or one individual, and that you have other county partners and community partners who are with you in this work. And we would love to hear about how you have built and leveraged those partnerships. And I think I should have said this before I opened my mouth and started asking the question, but I want to pose that question first to Merced, because this came up when we had a brief prep before today's panel, and we were really happy and excited to learn about your partnerships that you've developed.
So we're really fortunate in that our housing program coordinator for behavioral health is also the co-chair on our continuum of care coordinated entry system. And so with that, before even transitioning into CARE Act services, all of our housing support has been really connected to the entire continuum of care. With that, we've been able to leverage not only, you know, all of the different providers and services, but also the connections that we have as part of that continuum. And just knowing, you know, the process of being able to get individuals assessed so that they're, you know, available and on that list, and then connected to the most appropriate level of care. And I'll pause and allow Delilah to share a little bit more, but being part of that system has definitely beneficial to our clients.
I would also add within our division, care and housing are under essentially the same division. And so that's definitely been helpful in communication, sharing information, just the way that we have set up the program. In addition to that, we also have set up some pretty amazing relationships with our community partners. And so we're able to reach out and really see what's available for a client, and really trying to garner those appropriate placements for the client, not just a placement, but something that is going to be appropriate and that is going to garner success for them.
Thanks, Delilah. Thank you, Alexandra. Would love to hear some reaction also from Sacramento, because I spied you, Monica, coming off mute, and also because this came up in a prior conversation. Would love to hear about those internal county partnerships, those community partnerships, if that's with the COC, like in Merced, or a county public housing authority, whoever those partners are, and how you've worked with them.
Well, luckily Nicole and I have known each other for a minute as county employees. So our direct reports just deal with each other. So she's over Care Court. I'm over the behavioral health bridge housing. Her her managers reach out to my managers and just refer directly. So that's just fantastic. We trained together, our teams shadowed each other. But the most important partnership, at least as the housing piece goes, is with the shelter operators. And we try to educate our shelter operators with behavioral health bridge housing. We provide trauma-informed care. We make mental health first aid available. We do trainings on what BHBH is all about, what services are available, etc. And that project I mentioned earlier, where there's on-site mental health services, we're actually piloting that on a small scale on one of our smaller behavioral health bridge housing developments. And so that partnership has been very helpful because, quite frankly, the shelter staff love the support and the education because it makes their jobs a bit easier.
Yeah, and in addition to what Monica's team has provided, my care team has also provided education about what care is, what our team can provide in support, what the full service partnership that they are linked to can provide in support. And so we've also done that education. And then, of course, in addition to the amazing partnership that Monica and I have with that and being under the VHS umbrella, it has been so amazing. She's also our bridge to kind of some of that outside system of care as far as coordinated entry and HMIS. And so she's been our bridge for that. And then, of course, once we're linking them to their full service partnership, it opens up additional housing support, such as permanent supportive housing, room and boards, boarding cares, augmented boarding cares, and other programs such as those. And so we, with the support of our county council and public defenders, have really started to link people sooner into those full service partnership programs to really get the support of the partnership in the events where bridge housing may not be the best solution. So that's how we've kind of utilized our system the most.
And sorry, as far as our COC is concerned, I forgot. We got involved very early with our COC just for the sake of the clients we serve. So I'm actually chair of the governance committee and on the advisory board. And my direct reports, we have representation on almost every committee the COC has to offer.
So I want to follow up on this because Merced, it seems like you're very lucky to have a county employee working with yourselves who just happen to have had this leadership role in your COC. And then Sacramento, I'm hearing something similar from you. It just so happens that, Monica, you have these responsibilities in the COC. What would your guidance be to other counties who don't have those existing relationships and connections to their
Get on it.
continuum of care or other, sorry, what was that?
Get on it. At least here in Sacramento, all our committees are listed on a web page. So the ones open to public you can go to. Before I got on a committee, I was just in the audience all the time. And that's how I started developing relationships with them because I was on their coordinated access system, going to those meetings repeatedly, finally got on that committee. So look up what committees are available and how to get on them. Because we have a fairly large BHS system. We have our people from data going to the point in time count committee. We have people from cultural comp going to the racial equity committee. I have like my internal planners going to the system performance committee. So, and that way it doesn't fall all on one person, and we make sure there's a voice for behavioral health at every table. Because if you go to some of these committee meetings and you don't have representation, you're really going to hear how they, not maliciously, don't really think about us in the larger scheme of things when they're planning.
So, you know what? A colleague has just sent me a friendly message and said, "What are COCs?" And it would make sense for one of us to spell that out. That's not on you, Monica. I think that's on me. So a COC is a continuum of care, which is a local homeless services and supportive housing planning body where different partners come together to collaboratively make decisions about system priorities, priority populations, priority interventions, and to award some funding through local administration of a HUD funding competition. So one more follow-up on this before turning it over to my colleague Debbie for the next question. I'd love to hear about other partnerships, particularly with housing authorities or local regional centers. Have any of the counties on the panel here developed those relationships, or any counties in the audience, or anyone in the audience at all? If you have developed productive relationships with your housing authorities or local regional centers, please jump into the chat and share a few details. But first to the panelists, San Bernardino and Tuolumne, I'd love to hear if regional centers and housing authorities have been good housing partners for you.
We, in San Bernardino County, we do have a really strong relationship with our housing authority. We actually partner as the supportive service provider on multiple projects for them. Not necessarily care specific, however, given the populations that qualify into those housing options, we certainly can leverage that if necessary. But we actually meet every other week with our housing authority. We go through lists, we discuss, what's going on with MDTs and the individuals placed in housing. So we have a really strong relationship with our housing authority. And when they go out for new housing projects where they're developing or they're bringing on board new projects, they're always in communication with us about, how can we support? And if not us specifically, do we have a contract provider that we would be able to place into those systems? And so whenever there's issues that arise, we are always in communication, and or if there's a change in pace, we're in communication. So we have a really, really good relationship with our housing authority. We do have a good relationship with regional center as well, but we don't typically, other than do warm handoffs to one another, have ongoing like housing supports for a shared relationship with them, but we certainly do with our housing authority.
Tuolumne County is very, very unique. We have about 56,000 people in our county. We do not contract out direct services, and we have site control of all of our housing properties. So our interaction with our COC is pretty limited because all of our stuff is in-house. So I know that's not the experience of probably any other county on the panel, but yeah, it's very, we're fully integrated, our clinical and admin. And so we don't really have a lot of interaction with our COC.
We appreciate you sharing about the unique model that's in your county, Evan, and thanks to all the panelists actually for kind of an extended discussion on this question of partnerships. Over to you for the next question, Debbie.
Awesome. Okay. So thank you all. This has been such a rich discussion. And now we're going to move on to, and we hear a lot of questions kind of about this from different counties. So housing can be a really good opportunity to engage people and services. So can you give an example of how you might have used a housing first approach with someone who didn't want to engage in behavioral health services? And then how that, and kind of how you helped them move through the care process. So seeing lots of nods from Sacramento, we will head back over to you first.
Thank you. So I discovered when we implemented our homeless engagement response team, which does outreach both in encampments and in shelters, the rate of engagement with shelter residents versus folks that had to remain out on the streets was huge difference. folks that were sheltered were way more likely to accept services. We expect our service providers to visit at the shelter, provide services there, do case management, etc. And like I had mentioned, we had been piloting this behavioral health bridge housing with on-site services here, literally in our parking lot, that I would say out of 56 beds, 50 take services. It's pretty rare people don't take services. And our team is there to kind of stabilize them and engage them until they can get fully linked to their new provider. And definitely providing housing and having somebody stay in one spot, not only are they more likely to engage in services as service providers, it makes it immensely easier to coordinate care for them also. And then we've also discovered that people do come around and accept services. So at the behavioral health bridge housing where we don't have on-site services, we still have peer and clinical staff going out and doing outreach. And we use our peers to do groups. And that's another way we build engagement. We provide snacks. We might go over like budgeting. We do transportation Tuesdays. We do money Mondays, like resume Thursdays. And those folks are more likely to participate in services after that part of engagement. So Sacramento County, we firmly believe in housing first, and we adopt it. We also provide through our service providers rapid rehousing, and they also use the housing first approach just because it works in our community. I've seen the numbers.
That's great. Well, no, and you spoke to a lot of important things there first, right? If you address someone's basic needs, they're able to engage in services. But also when you meet their need, you build trust. And when you keep showing up, you build trust because you're engaging them with what's important to them. So those are amazing numbers. Thank you for that.
Yeah,
Yeah,
absolutely.
and I would add specifically to care, one of our very first petitions that we received was an individual living in his car. And so we were able to get him into the bridge housing. And because he was already housed and had agreed to the services that we then offered, initially he declined the services and said he was already in a program. Of course, we knew he was just in shelter. So once we were able to show he was actually engaging with his provider and staying stable in that bridge housing, the judge actually dismissed his care petition. So we've seen that, we were able to show that he's stably housed temporarily, but stably, and receiving services. And so because of that, he no longer needed the care program oversight. So that was a big success for us.
Thank you. Congratulations on that. And we know San Bernardino, we know you've had some great successes with Housing First as well. Would you like to share some of those?
What I can tell you is that we actually have a clinician that's assigned to our sheriffs. They call them the HOPE team, Homeless Outreach something team. We also, because our homeless division falls under me with our care and AOT participants and our FSPs for our ACT and FACT programs, we really have been able to utilize that clinician with those teams as they go out. And when an individual is ready, as I said earlier, for housing, you got to get them right then and there, regardless of, what the barriers may be. If they're using, we actually brought on recently 4 beds in one of our recovery residents that will allow us to place individuals that have gone through the SARC assessment and we know are awaiting either intensive outpatient or residential placement, and they can go into this recovery residence while they're waiting for that bed to open up. And in the meantime, our homeless outreach support team wraps services around them so that they're linked to a program. By having the clinician out in the field, they get eyes on individuals, and often the list that we get for petitions for care and or AOT, because we're finding sometimes there are dual petitions and or referrals that are being sent to us, we're able to locate those individuals and re-engage and engage. And as Alicia pointed out earlier, sometimes it takes a really long time. But when they're ready, we have beds available for them, regardless of if it's a congregate living like a board and care or room and board. Oftentimes there might be a little of a negotiation with them to, we know you're ready right now. Let's get you in here. Don't worry about anything else. And our teams get to them within 24 hours to try to figure out what they're willing to do as we move them through that system. We don't want them to stay in our enhanced shelter more than 72 hours, because the goal there really is to assess, evaluate, screen, and then determine where the best place is for them. But in that time, similar to what Monica said, our teams are on site and trying to assure that there's a relationship that's being built. And one of the biggest messages we always give is make sure that you follow through with whatever you said you were going to do, because if you said you're going to be there at 8 a.m., you can bet that they're waiting for you at 7:59. And
Yeah.
so that, those repeated corrective experiences help in the long term to be able to place people, and that negotiation with them down the line seems to fare much better. So we've had individuals that are under the influence that we can place and or may even be psychotic or but they're able to consent to, yes, I'll go there. They're not clothed, we'll get them. We have great shelter providers, as Monica said. Without our shelter providers, this wouldn't be as successful.
Yeah.
But through education and support, they have been 1,000% on board to do and flex in areas that maybe they hadn't previously. So we've had real success with getting people placed and then working through all of the other stuff on the back end. And Alicia, I don't know if you have anything to add.
Yeah, I was just thinking as everyone was talking, of course, building the relationship with the participant and the housing, but then the other piece, which I think Monica mentioned, is providing that support and building the relationship with the providers. Because the more we do that and have the FaceTime with them and are going out to the shelters or wherever the housing is and providing support, then the less likely that little issues will become big issues.
Yes.
The individual will have to be removed from the housing. So continuing that support and building relationship with the participant, but also the providers of the housing.
Absolutely. And you all touched on something so important there about the showing up and being on time, because the people we serve have so many disrupted attachments and such a history of mistrust, unfortunately, oftentimes with the system. And so that's one of the things I love about the Housing First model. And you really are offering housing on demand, which is amazing. Is that it really recorrects that, like, kind of that paradigm that we've often had of you have to earn your behavioral health services, you have to earn your housing. It's like, we're going to meet you where you are, and then we'll wrap around you when you need it. So thank you all for sharing that. And that other piece of going to the person, right? We often expect people who are in crisis to make it to us. And then we wonder why they can't. So when we're able to take those services to them, it builds that trust and really helps people meet that need.
One of the things, Debbie, just to add, and it's something that we're working with our community development and housing department and our Office of Homeless Services, is we also know that individuals have made home their outdoor living space, and with that comes a lot of things and belongings and pets. And so we talked about lessons learned, and we know this through multiple experiences that those things can be barriers to placement. And so I know when I worked in another county, they had the option to put belongings into locked buildings, and they were able to track people's belongings, because shelters their capacity to bring in a lot of stuff is very limited. And so I think building those abilities to put person's belongings into a safe space is really important, and something that I think we're working on with multiple departments. as well as the ability to bring pets in. And we do have some shelter providers on a limited basis that are willing to do that. Our hotel motels are a little more open to that, but it's a hotel motel may not be the ideal situation, as Monica discussed earlier, to place someone because, you know, a higher level of care may be needed, but it's absolutely something that needs to be considered, and we need better opportunities and options for those things.
Such an excellent point. Thank you. And really honoring, again, that goes to really honoring what's important to that person and not keeping that trust. Does anyone else have anything to add on Housing First before we move on?
I
What
just
we
want to
have-
jump in. Sorry, the pet piece, we're lucky we have some providers that have, actually all our BHBH properties have some ability to take pets. There's usually a limit, like 20 at this property, 30 at this property, just because of good neighbor issues. But that is a really big deal for folks to be able to bring their animals. And actually, when we do outreach, we frequently bring pet supplies too.
That's great.
I would have to echo what my colleagues have shared about just really building those relationships, doing what you say you're going to do, being there on time, and building that trust. And that housing first model is definitely key in providing those basic needs. And what we found is that by doing all of those things, our clients are not only wanting to engage, but they're also building goals of their own. So wanting to establish a PCP, wanting to establish dental care, wanting to find out about different types of programs that in the beginning were mentioned, but they just thought they may have been out of reach or weren't interested at the time. And now they're seeing that these things can happen and they want to improve their quality of life. So building relationships with the family as the family sees this person really grow and engage and follow through. And so there's been a lot of benefits to just establishing those basic needs. And again, just doing what you're saying and being where you're going to be and building that trust.
That's so important. And the importance of family too, right? Because that's often what a very big goal for people is to reunite with that family. And then Evan, we saw you were coming off of mute as well. Anything to add?
Oh, I was just going to say that one of the things that we try to stress with our case managers is when they're in a hotel or when they're utilizing emergency housing, that they're seen every day. Just because we have really good relationships with a couple local hotels and we would like to keep them. They've been great with one of our care court clients. They make sure that he has everything he needs, food, and they check in on him on a regular basis. So I think that was a partnership that I failed to mention earlier, is that if you need hotels, you better have a good relationship with at least a couple of them.
Yeah.
You're going to need their help, more help than they give their typical tenants.
Yeah. Absolutely. That's a great point. It is to make Housing First successful, you have to have those partnerships and a good community relations plan. And I think something that I heard from all of you that I think sometimes dispels some of the concerns that people have around Housing First is that it's low barrier doesn't necessarily mean low touch. You're offering housing and then you're putting the things around people to help them be successful and to help them improve the quality of life to eventually engage in behavioral health services, hopefully.
And Debbie, just to add, one thing that I often have heard staff, when they're frustrated, will say, well, I've asked them multiple times and they keep telling me to go away. And you have to be creative, find something. I tell them, look at their shoe, look at their shirt, find something about them that you can latch into and go, hey, I notice you're wearing a shirt that has Motley Crue on it. Do you like Motley Crue? I don't know. And then tomorrow when you come and see them, bring something that has a Motley Crue reference to it. And before you know it, they're talking to you and you're able to build a relationship at face value. If you come in as a clinician or a case manager, they're not going to accept that. You got to be human, find the area where you can connect whatever that may be, and then work off of that and stop trying to be the professional who knows more, because that doesn't work.
So true. Thank you for bringing up that very important point. And then we are, with 8 minutes left, we're going to go to a final question of, if you've had one housing success in your care work that you think could be replicated in other counties, what would it be? We'll start with San Bernardino. You all are to my left, and since you were just on mute, we'll ask you to start, please.
I would say we have one success in progress because we're just at the very beginning, but it was the one I was talking about earlier where I've been working since December, just having the conversation about housing and trying to get the buy-in. And as of this morning, he is willing to accept the type of housing that, you know, will benefit him. So more to come on that, but I'll count that as a win. Yeah.
Absolutely. Love that very recent success. So keep on the perseverance. Awesome. Thank you. And Sacramento?
Well, I've been talking a lot about our sleeping cabin shelters, but our big success is actually that we are contracting with several providers in the community. For example, a renovated skilled nursing facility has been turned into senior housing for BHBH, with care court clients obviously getting priority. Will be we invested in the redesign of a motel. We'll have 15 beds there. And we also have implemented funding. So we have 30 sober living environment beds. So our success is, I'll be honest, we've tried a little bit of everything, and it gives us a good variety to work with.
That's great. Really meeting the needs of the whole community. And
I'll let Delilah speak about the clinical specific case successes, but on a system-wide success, for the first 41 units within our behavioral health bridge housing, those we were able to work with the owner of the housing project, as well as our housing authority, and are in the process of converting all of those to project-based vouchers. So successfully transitioning individuals from transitional housing into permanent supportive housing, which is really amazing. And then we'll be able to utilize the savings to then, build additional transitional units beyond. So that's been really nice and somewhat unexpected from when we started.
great. Thank you.
I would say our best success in Merced was essentially, again, coordinating with our community partners. We had a client who had a history of homelessness, was in the criminal justice system. Care was a form of diversion. And so we were able to transition him from the jail to supportive housing. And that's been wildly successful for him. And so since then, he's been engaging in the program, has been participating in many services, as well as re-engaging with his family. So building those relationships that family had kind of given up on because of situations and the attempts to help that were unsuccessful in the past. And so now those relationships have really strengthened from what we're seeing. And that person has become a volunteer supporter. And so that, again, has been really beneficial in his success. And so that's one success story that we're really happy for in Merced County. And we're hoping for those examples to continue.
Awesome. And having that lived experience there to help the new people coming through is awesome.
Thanks, Debbie. And I'm going to hand it right over to Patricia for our final closeout. I want to give a huge thank you to our panelists. This is everything we wanted to get from this discussion and more. We got some success stories and some of your other lessons learned in all kinds of different county environments across the state. So we really appreciate you taking the time. And over to you, Patricia.
So we're grateful to our panelists and for our HMA team members who facilitated that conversation. Again, if you have any questions or you're looking for resources, please visit our website or also reach out to info@carac.org. Thanks, and we'll look forward to hearing from you.